We're just going to get started just because I want to be respectful of everyone's time. So I'm not too sure how many familiar faces are on this call, but I'll introduce myself. My name is Kirsten Ocella, and I'm the marketing coordinator here at Libertana. And today we are Libertana is hosting a online webinar just to really focus on discussing CalAIM and Respite personal care services. And our intent behind this entire webinar is to actually bridge the gaps in care, whether you're a discharge planner, social worker, case manager, or community partner. Our goal is to give you practical information where you can help improve outcomes for individuals and families that you serve. So as I mentioned, I'm not too sure how many familiar faces are on here or how many of you already currently do work with us, but I just wanted to give just a very brief general introduction to just who we are. So we are actually a family-owned health and social service organization. We serve vulnerable populations throughout California. Our census definitely is for sure larger than this now. I think we're closer to 800 nurses now in 2026. And then even the clients that we serve, we're closer to a census of 7,000 clients that we serve. And that's been increased since 2026. So some of the services that we do tap into and offer our patients are going to be our skilled nursing and home service. So that's kind of what we're talking about today is our home service, our respite and home care, again, a topic that we're also continuing to talk about today. Our case management, which is our resource connection and intensive care coordination. And then we also have our housing support. And these will be kind of the waivers that we offer, which are going to be our CCT, ALW, and HCBA. Not going to get too much into those, but I know there's a lot of acronyms I did throw out at everyone. And mainly what they stand for is CCT is our discharge planning service that Libertana does help with. And then we have our assisted living waiver. That one allows clients to be placed into an assisted living and receive ongoing payment for their cost of care. And then HCBA is a home and community-based waiver, which allows clients to stay in home and tap into services like respite. And then our role in CalAIM. So we are a CalAIM partner and we're focusing on whole person care, addressing not only the medical needs, but the social and environmental factors that honestly impact the overall health and independence of an individual. And our mission is simple. We want to help people remain safe and comfortable in their homes and their communities for however long they can. So I put an agenda together, and our agenda is pretty straightforward. It's mainly going to be CalAIM, respite, and personal care focus. So our first item on the agenda is what is the service? How is respite and personal care enhancing your discharge plan? How is respite and personal care going to fit into your care continuum? And how to identify an appropriate client? And how to refer, obviously, and then where does Libertana step in? What support are we offering you and the clients? Awesome. So, going into the challenges that many of you are probably facing, whether you're a hospital or skilled nursing facility, a lot of discharge patients are often the preferred outcome is to stay at home, but we know with that challenges do arise. And for many patients, the risks that they all face are hospital readmissions, delayed in discharge planning, unsafe living situations, a caregiver exhaustion, and limited support system. And we know with a successful discharge, it's not only on the medical clearance now. The question does now become who is helping the patient once they get home. Oh, I think someone might need to go on mute. Let me check. Just as a friendly reminder, can we have everyone go on mute just because we are getting quite a bit of feedback?
You are no longer muted.
Right. Thanks for everyone's patience. So yeah, as I mentioned, medical isn't the only factor we're looking at now when it comes to having a safe discharge. The question that does arise is who's going to help the patient once they get home, and without the adequate support, even a medical stable patient struggles to remain safe at home. And this is where our community supports do step in because they're addressing the social and environmental needs of the client once they are discharged home. This is now stepping into the shift in care that we're delivering. So healthcare continues to move away from an institutional model and towards a person-centered care. And historically, we primarily focused on hospital skilled nurse facilities and a standardization of treatment plans. And as I mentioned previously, I think in the healthcare system, we were only looking at what's the medical diagnosis and how can we treat the medical, and realizing that now moving to this new model with CalAIM, we now recognize that there are more influences to create a successful outcome. And some of those influences are going to be the environmental and social components of having a successful discharge. And that's where CalAIM embraces that model, and it considers a whole person rather than just a standardization of care. And under CalAIM, this includes home environment, caregiving support, housing stabilization, transportation needs, and social determinants of health. The goal to meet people where they are and provide services and support are key to having a long-term successful outcome for patients to stay within the community. So now kind of covering why we are doing what we're doing and Libertana's role in it, I just want to talk specifically what is respite and personal care, because I'm sure with you guys being discharge planners and social workers, you're constantly being told like of this new thing that patients can tap into. So what exactly is our CalAIM respite and personal care service? And the service is a temporary caregiving assistance and support for our Medi-Cal members at no cost to the client. And what's designed to, it's to reduce caregiving burnout, support clients during their critical transition period of hospital to home, increase access to their in-home care, and then promote independence and dignity. Most importantly, these are to complement the existing service and supports that a patient already has. To name one, for example, is IHSS, and not replace them. So we want to add on top of that. And then for many families, our respite services provide a relief in need to continue caring for their loved one at home. And just kind of to tap into a little bit of what exactly does respite and personal care do. These are all going to be non-medical services that our caregivers would assist with. And to name a few, some of them are going to be bathing and grooming, feeding assistance, mobility support and transfers, light housekeeping, laundry, meal preparation, transportation to and from appointments, supervision, safety monitoring if needed, and then grocery shopping and essential errands. Primarily what these services are made for is that they're supposed to serve a practical day-to-day assistance, helping clients maintain their stability and independence in their homes. And importantly, it's just to give the primary caregiver a break and a peace of mind that their loved one will be cared for if they do need to step away, whether it be personal or other reasons. They're in good hands. So I know after hearing all this information, it's like, okay, yeah, this is a great service, but why does it matter? One of the biggest challenges healthcare organizations do face is what happens after the discharge. And for our post-discharge period, it's a very vulnerable time for our clients because anything that comes with health, no matter the change, it's a change in general, and it's really hard to adapt after that huge change. And what respite is intended for, it's to help close that gap by providing immediate support in the home. And some of these benefits include extending the care beyond the hospital, supporting both the member and the caregiver. As I was mentioning in my previous slides, this service is actually helping two people, not just the one. Reducing risks for care breakdowns, and then also preventing avoidable readmissions. For high risk individuals, this caregiving support is not just a simple convenience, it's often the key factor why they remain safely at home and don't have to return to the hospital. So I was just going to walk you through a case study we have here. So we have a 34-year-old client with receiving ongoing support from his caregiver with lighthouse, where this caregiver assists with light housekeeping, laundry, and meal preparation. Our client often experiences clutter in his home, and particularly with his papers and frequent searches for misplaced items at times. It makes it challenging to keep the home clean and organized. And the caregiver continues to help maintain a safe and tidy environment while providing gentle reminders and ongoing support. This caregiver also assists the client with laundry by encouraging him to participate in processes and by washing his hands regularly and help folding and organizing them. This support helped him remain at home more engaged in maintaining his personal care and household responsibilities. The client recently began attending school, and the caregiver adjusted her schedule to continue providing the support. He is thankful for the caregiving assistance and appreciates the care, consistency, and stability she brings into his daily life. So something that Libertana like is our heartbeat in our messaging is that we want to be the assistance, but we also want to promote independence. And in our case study, this is something that the caregiver did exceptionally well, because not only was she helping this client out by offering her assistance, but she was also prompting him and even encouraging him to take on the tasks himself first, and she could be there as an assistance or a supervision to help him build that trust within himself again. So going into eligibility and referrals. So to qualify for respite and home care services, an individual must meet uh, these following criteria. One, to be enrolled in either enrolled or eligible to enroll in IHSS. Uh, so if a client you've identified isn't in IHSS but could be tapped in, we can help them enroll into it. And then they have to be with either LA Care or Anthem. Those are the two managed care plans we are currently contracted with. So as long as they have those two managed care plans and either are on or need to be enrolled in IHSS, we can help them out. And it's actually really simple to refer to us. So you can actually do one of two ways. I've left our QR code here, and then I've also included our email. So this QR code is going to take you to our contact page on our website, and it'll pretty much push you through the same way you would emailing us. It's going to have the contact form where you list your name, who you are, and then what message you would like to write to us, or you can email us directly at info@libertana. Both myself and my manager, Denise, oversee that email. So you would actually hear a response from us within the day, uh, just acknowledging your referral and then passing it on to our respite team to go into further detail of what the next care steps would look like in that client's referral process. So as I was mentioning in the previous slide, you would establish the contact with us, and this is just going to walk you through a pipeline of what to expect when you do refer to CalAIM services. So the first thing is that the client is good fit. So determining whether the client is appropriate for in-home support or enrolled in a Medi-Cal managed care plan, including our CalAIM support. So we want to make sure that the service that you've identified you believe is a good fit is actually going to fit the right care criteria. Then we would submit the referral. So that once you've established contact with us, you kind of already on step 2 by submitting the referral. So you've either emailed us or we've already connected you with our respite department, and they would have you fill out an online form or have the client, if they're able to, fill out that online form asking for specific questions. Then moving into the referral review. So now our respite team has taken the time to look through the form that they sent you, as well as then conduct an assessment on what level of care this client will need, and then also reach out if there is any additional documentation that they would need from you or the client. Then going into step 4, this is when our respite team is going to be in contact with our managed care plans, and that's either, like I mentioned, that's either going to be LA Care or Anthem. They are going to request an approval from an authorization for service for them, and then once they approve, that's when we can start jumping into services. So as I mentioned, it's going to be step 5. We would receive referrals from, or we would receive an approval from one of the managed care plans that client is under, and then after we receive that referral, we can then do ongoing case management and support, as long as the client is however much time that the managed care plan authorized, and then have a case manager either advocate for more time if needed once that time limit does expire, or we would reassess what care looks like after that. So Denise and I have hosted a few of these, and I do know we are throwing a lot of information at you guys. So I thought it would be a great idea if we at least prep some of these questions to kind of open up the floor for additional questions you guys might have. So I know a very common question that gets asked is that, is our respite and personal care service the same as home health? No, it's not. And the reason it's not is because our respite and personal care services are going to be for caregivers. They're non-medical, so we don't have an LVN or RN administering these services. This is going to be family members that either referred. So I know with a lot of clients, whether it's the child, the mom is like the primary caregiver, and they bring on maybe an aunt or a cousin to be their respite caregiver while the parent needs to step away. And under Libertana, when we do receive a referral from a family to bring on a caregiver, that caregiver would be trained on that client's needs, as well as compensated for their caregiving hours and duties. So how quickly can services start? I know a lot of people want to know, okay, like this seems like a great service, but when does this actually happen? So in many cases, services happen within the few days of the referral and the approval. So obviously, the quicker you are and the more diligent you are about getting the paperwork in, the faster it moves. And then if there are any hiccups in the process, our respite team will be reaching out to you directly to kind of let you know what's happening and why there is the wait or snag or whatever may be. But we try to get these referrals in as soon as possible and get services within those next few days. And then how long does a respite service last? This one really just depends on the client. Like I was mentioning in the slides previously, our care coordination team will continuously have that communication with that client and the family to, one, not only assess if there is an increased need for respite and personal care support, to advocate for you to increase those hours per your authorization with the managed care plan, but also to just assess like what's next step in the patient's care continuum that we can then tap into under respite and personal care. But yeah, that was a very roundabout way of saying it depends on the client and what they need. And then I know another question that does come up quite often is, does this replace the primary caregiver? No. Kind of what I was mentioning in the first question, as is this the same as home health? No, this doesn't replace the primary caregiver. This is only just expanding the circle of help that a client does get to lean on. So like I mentioned, this is a temporary support that allows the caregiver, like the primary caregiver, to step away, whether they just need a mental break or do have a trip coming up and need a few weeks off from like their primary duties. This is something that they can tap into, knowing that whoever they either refer or if they need an outside resource, we can also staff those caregivers as well. With our own staffing, that they're going to be in good hands if they do need to step away for however long they do need to step away for. So I do want to open this up to questions.
Hi, I'm Sadie. I'm a social worker with UCLA.
Yeah.
I just have a question, actually two. My first question is for the respite care. So Libertana is also a home care agency that provides their own caregivers, or do you guys have like vendors that you use for those services?
So we do use a vendor, I believe, over in our Fresno area, and I believe um in parts of our LA region, depending if we don't have our own caregivers who work that region, we will contract out to 24-hour care. And that's only if we don't already have caregivers in that area staffed. But yeah, we do have our own caregivers.
Thank you. And then, do you know how many hours LA Care, like what's the max amount of hours that they approve for respite?
I would have to look into that. I would have to talk to my respite coordinators because I know it just depends on clients, but I know it's like, yeah, let me just talk to them because I don't want to like give a wrong number out there, but I think it's like around the 300 range. But let me ask them and I can get back to you.
Okay, thank you.
Awesome. Was there any other questions regarding the topics we discussed today? And I know sometimes like people will have client specific questions. Definitely feel free to email that info@Libertana link. Like I mentioned, or yeah, like I mentioned, Denise and myself oversee that. So you'll be connecting directly with me when you email that link. You everyone for joining. I will be posting this webinar to our YouTube channel. And like I mentioned, we uh, if you do have any questions in the meantime, or if you do want to send this to any of your other staff, it will be on our YouTube channel. And then you guys can reach out to Denise and myself anytime for any other questions. We do have a webinar coming up next week. I know it's not going to be for our respite service, but it's also another service that we do offer. And it's the acronym is ALFT and it stands for Assisted Living Facility Transitions. So this is going to be for any clients that are looking for placement into an assisted living facility. If you would like to join that webinar, definitely shoot me an email and I will include you on the invite list for next week. And it's going to be the same time, Tuesdays at 11 a.m. Awesome. Well, thank you guys so much for joining. And I hope you guys all had a great holiday weekend. And I look forward to continuing to see you guys on these webinars or even see you in person if I'm in the LA area. All right. Have a good one, guys. Bye.